Hi, everybody. Thanks for joining us tonight. I'm Dr. Kyle Swanson here with Dr. Beth Reiniger from KSB Foot and Ankle Center. And we're here to present tonight on diabetes and feet health. We'd like to thank KSB Community Wellness and Aaron Fox for putting this presentation and event on this evening. And further ado, we'll get started here. So some of the topics we're going to cover this evening is diabetes and the different types, symptoms, and complications. Along with this, we'll also discuss treatment options and some preventative measures regarding foot care and shoe wear to help prevent some of these complications.
So I'm going to talk a little bit about some Centers for Disease Control and Prevention facts. So in 2018, they came out with some guidelines and stated that 34.2 million people had diabetes in the United States. That's about 10.5% of the United States population. And out of the percentage of adults with diabetes, 26.8% of those people are over the age of 65. So we're going to talk about the different types of diabetes. So you have type 1, which the pancreas does not produce enough insulin. This usually happens with children and young adults, and that's about 1 in 400 to 600 children. And some risk factors include autoimmune and genetic factors. And then you have type 2 diabetes, and this is where the pancreas loses its ability to produce insulin, and usually this is an adult onset, and that's about 90 to 95% of diabetic patients, and some risk factors for that include obesity and physical inactivity, older patients, and then those with family history as well. Some other types include some genetic defects of the pancreas. So this can be drug or chemical induced, or also due to infection. And then there's gestational, so in pregnancy, and that's can be seen in 3 to 10% of pregnancies. So symptoms, there's a triad. So you have polydipsia, polyuria, and polyphagia. Polydipsia means that you have increased thirst. Polyuria, you have increased need to urinate, and polyphagia, so you have increased hunger. Some other symptoms include peripheral neuropathy. You have numbness, burning, or tingling. You can get loss of sensation in your feet, which usually begins at the toes, and it can work up your lower extremities. Hypersensitivity, and temperature imbalances.
Okay, so now we're going to change topics and talk about complications. So diabetic foot ulcers is one of the most common complications of diabetes, and we see this very, very often. Diabetic patients, 15 to 20% will develop an ulcer in their lifetime, and up to 20% will require an amputation. Diabetic foot ulcer is also the most common precursor to a lower extremity amputation in the diabetic population. 85% of patients requiring an amputation first had an ulcer. So this is very important why we need to try to prevent these ulcers from developing, so we can prevent these complications and amputations. In regards to peripheral neuropathy, there are 3 main topics and subsets. The first is sensory, so that is the loss of feeling in our feet. That goes with mostly the numbness, the tingling, the burning, hypersensitivity. The other side is the motor function. And so what can happen is the nerves get damaged that help with walking, and you can develop what's referred to as foot drop, where you have difficulty lifting your foot up off the ground, and that can be troublesome in causing instability and can result in trips and falls and other injuries as well. Equinus is tightness in the back of the leg. We have a tight Achilles tendon, tight calf muscle. That is actually the most deforming force of the entire foot and ankle. So when that develops, it can really cause some issues as well. Hammer toe deformities can also develop. There can be an imbalance of the tendons in the toes, and what happens then is that you're walking on the very tips of the toes, and that can develop a callus and an underlying wound, or even on the top of the toes as well. The autonomic nervous system is responsible for healthy skin, and if there's complications in this subset, what you can experience is dry, cracked skin, and when you get these cracks in the skin, that is the perfect portal for bacteria to get in, which can start an infection. So treatment options, proper blood glucose control is going to be very, very important. We strive for our diabetic patients to have a hemoglobin A1C of 7 or below. A healthy diet and exercise is very important as well. If our patients feel that they need some assistance in a healthier diet, we do have registered dietitians that we'd be happy to get them referred to and set up with a good regimen. Routine foot exams are very, very important. During a routine foot exam, we can address nail care. As you can see in that picture, those nails are pretty long and look like they need some attention. Calluses, under calluses is where we typically see wounds. And then we can also identify any underlying conditions. In regards to that, that refers to as vascular issues, whether that be with the blood flow from your heart down to your feet via the arterial or arteries, and also the blood flow from your feet back up to your heart via the venous system or the veins. Also, infection is something that we definitely don't want to miss. And if we identify this early, it helps with treating this early and prevent those complications that we were talking about earlier. Other treatments, supportive shoes regarding specifically diabetic shoe wear and inserts. These are a couple pictures of the diabetic shoes that are commonly used. The inserts that go in diabetic shoes it's usually a 3-layer insert, and what that does is it helps offload any high pressure areas and can help prevent those shearing forces, which is that pressure and then turning, which reduces friction and the development of calluses and wounds as well. Offloading pads can be helpful as well. That picture of the foot with that horseshoe pad can help offload a high pressure area. Various bracing can help as well, and physical therapy. We work really close with our physical therapy department, and if we see a motor deficit or decrease in stability or balance with walking or gait, that can be very helpful in gaining that strength and stability. Other treatments regarding medication. In regards to diabetes, there are a variety of oral medications and also insulin. And with peripheral neuropathy, there are topical compounds that can be helpful. Also other oral medications, and then supplementation. Vitamin B and C have been found to be very important in nerve health and can aid in prevention or slowing up the progression of those neuropathic symptoms. So some preventative measures that we can take to prevent the complications is, number one, proper blood glucose control. We can really keep that A1C around 7 or below. That's going to be very, very helpful. Healthy diet and exercise as well. I can't stress enough the importance of supportive shoe gear, making sure there's a wide toe box if there's some sort of structural deformity, for example, the hammer toes or bunion deformity. The inserts that go in those shoes to offload those high pressure areas. And then wearing white socks. I know it may seem kind of simple, but if you have neuropathy or decreased sensation in your feet, if you happen to get a cut on the bottom of your foot, you may not necessarily feel it, but you see the blood on your sock, and that can help you in identifying that you do have an injury. Feet hygiene, keeping your feet clean and dry, but not too dry. We don't want to develop any cracks and portals for bacteria as well. And then adequate routine foot care, as we discussed with nail trimming and callus care. And then addressing these concerns early. The earlier that we can identify an issue, the earlier that we can get it addressed and keep you back on your feet and living the life that you want to live. I'd like to talk a little bit about our wound care center. For any patient that does have diabetes or that is not diabetic and has wounds, we do have a wound care center in the KSB Annex first floor, where we have a team of providers to help assist with healing wounds. We take a comprehensive approach to healing these wounds, and so everybody works as a team, and we address the wounds, but we also address any underlying conditions that may need attention to help speed up the healing of these wounds as well. is interested in setting up an appointment, our contact information is 815-285-5814. So I'd like to thank you for joining us tonight. I hope that this presentation was helpful. If you'd like to leave any comments or questions down below, we'd be happy to get back to you. And I hope everybody has a safe and fun spring and stay healthy. Thank you.
Bye, everyone.